How do you pay for osteoporosis injection costs? Managing osteoporosis often involves injectable medications like Prolia or Evenity, which can help strengthen bones and reduce fracture risk. But figuring out how to pay for these injections can seem complicated. The good news is that there are several options to help cover the costs, depending on your insurance and personal situation. First, insurance coverage plays a big role. If you have Medicare, especially Medicare Part B, it usually covers injectable osteoporosis medications when a healthcare professional administers them. Medicare typically pays about 80% of the cost, leaving you responsible for the remaining 20% plus any premiums. If you have Medicare Advantage or Part D plans, coverage may vary, and you might need prior authorization. Medicare can also cover home health nurses to give injections if you meet certain criteria, like being unable to self-inject or having a fracture related to osteoporosis. Private insurance plans often cover these injections too, but the details can differ widely. Some plans requiring prior approval before covering the medication. Coverage might be under the medical benefit if you get the injection at a clinic or infusion center, or under the pharmacy benefit if it is dispensed through a pharmacy. It's important to check your specific plan's formulary, which lists approved medications, because if your medication isn't on the list, you might face higher costs or need special approval. Out-of-pocket costs can vary. Without insurance, a single injection like Prolia can cost between $1,700 and $2,500. With Medicare Part D, your out-of-pocket expense might be around $270 every 6 months, but this depends on your plan's coverage phase. Copays and coinsurance will depend on your insurance, and additional office visit fees might apply for the injection appointment. Many drug manufacturers offer assistance programs to help reduce costs. For example, companies like Prolia and Evenity sometimes have copay savings programs or patient assistance programs that can help cover copays, deductibles, or even provide medication at no cost for eligible patients. These programs are especially helpful if you are uninsured or underinsured. To manage costs effectively, it's a good idea to verify your insurance coverage before starting treatment. Talk to your healthcare provider about whether prior authorization is needed and ask for help in obtaining it. Also, inquire about any assistance programs offered by the medication manufacturer. Considering supplemental insurance plans or discussing more affordable treatment options with your healthcare provider can also make a difference. In summary, paying for osteoporosis injections involves understanding your insurance benefits, especially Medicare or private plans, being aware of your out-of-pocket responsibilities, and exploring assistance programs. Working closely with your healthcare provider and insurance company can help you find the most affordable way to access these important medications, ensuring you get the treatment you need to maintain strong bones and reduce fracture risk.